Well, for more now, let's cross over to Mirella Hodeib. She is communication coordinator of the International Committee of the Red Cross in the Yemeni capital, Sana'a. Ms. Hodeib, thanks for talking with us this morning. Just how serious is the humanitarian situation in Yemen right now?
Good morning. Thank you. The needs in Yemen are massive, and it has been building up for years now. Yemen, even before the conflict of 2015, is one of the Arab world's poorest countries. So the conflict came to add a layer. More than 75 to 80% of the population is in need of some kind of aid, mainly food aid and access to healthcare. So we see scenes of misery across the country, in the south, but also in the north, in Hodeida as well. The needs are huge, including, of course, food, access to clean water, access to healthcare, and so on and so forth.
So 4/5 of the population in Yemen are in need of aid, if I understood you correctly. What are the biggest obstacles you face in getting aid to the worst affected areas?
Well, of course, there are many challenges. Of course, the complexity of the Yemeni context, conflict, the multiplicity of actors, the difficulty of movement across the country, the restrictions on imports, but also the massive humanitarian needs. Aid organizations on their own will not be able to respond to the massive needs. This is why the International Committee of the Red Cross has been calling for a political solution for the conflict in Yemen to ease the suffering of the population.
Now, the fighting in Yemen has been intense. We're getting reports, though, of a lull in the fighting around the port city of Hodeida, which is crucial to supplying Yemenis with aid. Are you confident that the current mediation efforts between the warring factions in Yemen will be fruitful?
Absolutely. Hodeida is a lifeline for Yemen. Its port brings in basic commodities, but also aid to large swaths of Yemen. The lull in the fighting is definitely positive. It will provide a breathing space for residents of the city to either leave it or undertake necessary movements to buy provisions or seek medical help for an ailing family member. Over the past couple of days, because the fighting has slowed down considerably, Thawra Hospital also started receiving patients. We know that their ER is now fully functional with dozens of patients, and clearly this is a hospital providing a crucial service for the population in Hodeida. And as long as it is working and people can access it, they will come. Thus, the importance of this lull in the fighting in Hodeida.
Okay, just final follow-up. Are you confident that these mediation efforts could bear fruit?
We really hope so. Right now, we really hope that every effort is exerted to bring an end to this massive humanitarian catastrophe in Yemen. So any efforts are welcomed, any efforts are supported by the ICRC.
Mirella, Ms. Hodeib, thank you so much for talking with us. Mirella Hodeib there, communication coordinator of the International Committee of the Red Cross in the Yemeni capital, Sana'a.